Well, in the basic training, it's very good for everyone to know, psychologists, dentists, medicals, to know the span of hypnosis, because hypnosis can be used to reduce symptoms, and there are some professionals that can do that, especially with people who have an organic complaint. If you know that you are diagnosed and you have an organic complaint which is causing pain or irritation, or it's causing immobility or other problems, symptoms, there is no danger in alleviating or reducing the symptom because it doesn't have any psychological origin. And with hypnosis you can do so much for a better life quality, by teaching the patients methods, hypnotic methods, so they can use self-hypnosis to improve their life quality. And it's always good for psychologists to hear and learn about those directive techniques, because there are some problems on the psychological level as well that you can deal with without really exploring or analyzing. While I, as a psychologist and psychotherapist, very often first explore, but there are also nice creative methods to really make sure that your diagnosis is right. If you have in medical practice, for example, a patient who seems very reluctant to do the homework or to follow prescriptions, you can, if you are trained in hypnosis, you can do some projective questions by using imagination, imaginary questions that reveal if there is a secondary gain that the patient, because some patients sometimes they are not very eager to reveal if they have a secondary gain, or they may even say, oh, of course I want to be healthy and I will do everything you say, this is my hope. And then they stay with their symptoms and you don't understand really why. That can also be done in the medical realm with the help of hypnotic diagnostic techniques. So, and of course in most medical conditions people who work with medicine meet a lot of patients with pain, and if anything is really validated, evidence-based, it's hypnosis in pain treatment.
And maybe just a couple words about two-year program, you know.
The reason that there is a two-year program is, in Sweden there are some people who have stopped the training after the basic program, and when I follow up them, they say, well, I don't use hypnosis anymore. Why? Because in their workplace they are the only ones who are trained in hypnosis, so they don't get the encouragement from their everyday professional life to continue working with hypnosis. And although you have done the basic training, you have listened, you have done exercises, but it's not really your own competence yet. So you actually need 2 years with practice in between the meetings to really make this your own competence. And there are several techniques like affect bridge or various associative techniques where you associate behavior, thoughts, feelings, and realize and uncover, when you work explorative, what feelings are associated to what origins. How did this start? When did it start? A really good teacher of mine long ago, Dabney Ewan, he was a psychiatrist and a surgeon. He had 2 professorships, and he worked a lot with finding out the origin of inexplicable pain, for example, by finger signaling, and that we will we will do it with finger signaling, where the unconscious mind can speak through body language. And I like very much the imagery techniques, like imagine you are backing through a paper wall, what happens? And a lot of things happen with small, easy exercises. Imagine you are in a big hall, and in the middle of the floor there is a hole, and you are climbing down there. What does it look? And then you use your senses again. What do you see? What do you hear? Is there any smell? What is the atmosphere like? And so on. It's a creative technique, or techniques, because there are so many. And there are so many, so some therapists, they say, well, I recognize this from CBT, schema therapy, from self-compassion training, from EFT. And why do we call it hypnosis then? Well, I honor the old tradition. Hypnosis has existed for 110 years. And it has been developed and developed and developed, so the quality is really fine. And I can see with the newer, later techniques that are about the same, they have the baby sicknesses still. So that's why I like to stay with the hypnosis and the Hypnosis Society. And you asked also, what's in it for the members to become members of the society? In Sweden, I say that so many people complain, so many professionals complain about the bad quality done out there by hypnotherapists. And one of our mission in our society that we really need a board to do and a constitution is to spread out to ordinary people what quality hypnosis is like. Professional hypnosis used as an adjunct. What is it like? What's the difference? So that is good for the members as well.
All right. Thank you.
Thank you.